It's one of those accidents that I guess you never think will happen to you.
We were just wrapping up. I heard something first behind me before I saw it. When I heard a little bit of scuffling, I looked back. The horse was in mid-rear, almost like a hi-ho silver kind of thing, and flipped over.
He was a huge horse. He was an ex-Grand Prix horse. It was about my third time on him and my second time jumping him, so I was really new to him. Hi, I'm Lizzie Hartong. I'm 17 years old and I'm from New Canaan, Connecticut, and this is my horse, Clark. Around the age of 7 or 8 is when I first started riding, but I got really competitive more like 10 or 11, and that's when I really found like my passion for riding.
Hi, I'm Michael Leslie. I'm an assistant professor of orthopedics and rehabilitation at Yale Medicine. On an average week, I personally reconstruct anywhere between 10 and 15 patients.
I mean, I knew going into it, it's a really dangerous sport.
It was one of the worst accidents I've ever seen.
I fell off the back of the saddle, and so the horse fell onto me and sort of crushed my pelvis down to the ground.
You know, I could just tell from the moment I looked in her eyes that this fall was so different from anything else.
My initial assessment of Lizzie was a bilateral injury to her pelvis, where the bones broke in multiple places, creating an unstable pelvic ring injury. This segment of bone is really remarkably displaced from the other segment. The force at the time of your injury was just tremendous.
She had to be in an enormous amount of pain.
As a parent, it's hard to see your kid going through something like that.
All right, hi Susan.
Hi.
Out of all of the injuries that we treat as orthopedic trauma surgeons, injuries to the pelvis and the hip socket are the most complex.
Off the bat, Dr. Leslie made me feel really comfortable. I knew I was in good hands. He was really good at explaining to me what had happened and what he was planning on doing and what the recovery would be like. I just felt really secure in that.
Lizzie's body made it extremely challenging to give her an adequate reconstruction without giving her any internal fixation.
I was a lot smaller than some of his other patients, so there was really no way for the bar to be internal.
The external fixation device has pins that are inserted into the pelvis into specific corridors of bone. Then we're able to bring the pelvis into the proper alignment and allow our pelvis to heal in the appropriate position.
I couldn't lie on my side at all, so I was on my back the entire time because of the hardware, and just being able to get in and out of the hospital bed into the wheelchair was really difficult.
She was very focused throughout her recovery, despite having the typical ups and downs of external fixation.
It took me 12 weeks after the accident till I was able to get back on the horse. And I think immediately once I was back in the saddle, it was relief.
She really came through this quite well.
Lizzie could do whatever she wants with this sport. She has the ability and the means and the mental capacity to take it to whatever level she really wants to.
Understanding what patients do on a daily basis is a very challenging thing. Yet I understand the risks of some of the activities that we participate in. And my goal is always to enable that patient to get back to that.
I think riding will always be a part of my life. I have no intentions of stopping. I think it's a big part of who I am. I couldn't imagine my life without it.